Important health news for parents this morning, which could also be a bit of a relief. For years, there's been confusion over just how much acetaminophen you should give small children. Acetaminophen is what you might know as Tylenol. Well, parents are now getting some really important help. Medical correspondent Dr. Jennifer Ashton is here with the latest. And when you've got a screaming child at 2 in the morning, you want to help them.
That's correct. We've all been there. Good morning, Erica. Acetaminophen is one of the most commonly used pain and fever relievers for infants, but it can also be very dangerous if it's given improperly. But now the FDA may step in to help reduce the chances of an overdose.
How's he been acting?
Okay, he's doing better.
For parents like Jennifer Kanan, giving her 1-year-old son Joseph fever and pain medicine has always been confusing, especially as he currently recovers from an ear infection.
It's quite frightening if you're home and it's really late and I have a high fever and you're frantic and saying, okay, is this the children's or the infants? And if it's the infants and he's under 2, then what's the dosage?
That's because most packages say to consult your doctor when giving acetaminophen to children between the ages of 6 months and 2 years. And that leaves worried parents guessing the dosage.
They don't even tell you if they're under 2 how much to give them, in which case I'm scrambling online or calling my doctor.
But on Wednesday, an FDA advisory panel voted unanimously to recommend that dosing instructions for children under 2 be added to popular pain and fever relieving drugs, and that they be based on a child's weight.
An overdose of acetaminophen can be very serious and cause liver damage and even death.
Last year alone, 7,500 emergencies were reported to poison control centers across the country due to accidental dosing errors.
As a pediatrician and a mom of 2 young boys, I am excited by these new guidelines, and I hope that it means that we see few overdoses and that parents can safely dose their children with medication when needed. His ears look great, so let's just see him back for his 1-year checkup.
Okay, excellent.
Potentially life-saving guidelines for Jennifer Kanan and parents of infants nationwide.
So, Jen, give us an idea. Why haven't drug makers up until this point put out recommendations for kids under 2?
Right, you would think that they would have done it sooner, Erica. But first of all, to clarify, we're talking here about the single ingredient products containing acetaminophen, also known as Tylenol. And I think there are a couple of reasons, but this is a trend that has been increasing in the recent past, and doctors and the government alike have been following it. Ideally, parents would consult their pediatrician and their doctor before medicating their child. But as you and I both know, and as any parent knows, that's just not always realistic or possible.
So that was the reason they're not doing these new guidelines are going to be based on not only age but on weight, which is the way the other guidelines are for ages 2+.
That's correct. And in reality, Erica, medically, that's the way most medications are dosed. They're based on weight, not on age. They'll also be uniformed dosing devices. So instead of saying the word teaspoon, which is fraught with confusion and the possibility for error, there will either be droppers or measuring cups, making that dosing much more precise, much safer. And we have to remember, not every fever in a baby or a child even needs treatment. So again, talk to your pediatrician.
Still important to consult your doctor. Real quickly, when does this take effect?
Well, we don't know, but when this panel makes this judgment, the FDA usually, but not always, follows their advice. As soon as we do, you'll be seeing all of the dosing recommendations on this packaging change.
All right, Jen, thanks.
You bet.